The following segment is sponsored by Oakview Medical Associates.
Welcome back. Every Tuesday at this time, Dr. Nita Bijoor from Oakview Medical Associates is in studio. We've talked about topics like nutrition, heart health, and the flu, lifestyle medicine too. But today, Dr. Nita is joined by one of her patients, Tony Sturry. So good morning to you both.
Good morning. Thank you.
Tony's here to talk about his experience with Dr. Bijoor's weight loss program. But first, Dr. Nita, we're talking about the prevalence of obesity. You've provided a series of maps. Talk us through those.
Absolutely. The obesity rates have just gone up exponentially in the U.S. If you look at the maps there, from 2011, we had a lot of states where the obesity rates were 25%, up to 30%. No state in above 35% obesity. And then as we move forward, 2012, it goes up. Most of the states, especially towards the right, you start seeing 30 to 35%. And as we progress along, 2013, many more states have higher rates of obesity. And then 2014, 15, 16, kind of the whole eastern and Midwest area have gone up to 35%. Several states in the over 35% obesity prevalence. And by 2016, 17, and then in 18, majority of the states are in such a high prevalence of obesity, with only in 2018, Colorado and Hawaii are the only two states with 20 to 25% obesity rates. So that just goes to show how, and this has been linked back to several lifestyle choices, majority of which is the increased sugar consumption.
That's the big thing. I know there are a lot of factors, but you've identified the high sugar consumption as being a main problem. So talk to us about that.
Yes, and here's a slide, showing you through the CDC the consumption highest amongst smokers, less educated, and people in the 18 to 24-year-old age group. Much more prevalent in the rural counties compared to the urban counties. And all the states across the board, sugar consumption has gone up. Every individual at least drinking one sugary drink a day. Over the last 100 years, our sugar consumption has gone up by 80 pounds per year. So
that is hard to imagine, but we're certainly addicted to sugar. Now, Tony, you can talk to us about Dr. Nita's weight loss program firsthand. Tell us your story.
Well, my family and I moved here from Maine to the Upstate back in 2009, and we met Dr. Bijoor in July of 2009 after we purchased the home. So moving is both stressful and exciting at the same time. And we've been with Dr. Bijoor for 11 years. Both my wife and I have been with Dr. Bijoor, and it was shortly after she opened up her practice. And from that point forward, we started moving along toward a goal of weight loss and just better health, lifestyle. It's her program, The Body by Bijoor. The weight loss is a element in a larger picture for the person to have a better life.
What worked for you specifically? I'm sure there were a lot of adjustments that you made.
Well, whenever I made the choice, to take that step, okay, can be a tough choice, but people can do it. You can do it. I mean, you can take a lot of small steps and have many successes. But I was interested in running a marathon my life. I wasn't interested in how fast I can lose 10 pounds, how fast I can lose 20 pounds. I wanted a lifestyle change. I wanted to be empowered to learn more, have more at my discretion over a long period of time so I could take care of my family, friends, and extended family. So that was the direction that I went into. And the partnership with Oakview Medical Associates, Dr. Bijoor, and working with their family provided me motivation and just so many tangible things that has pushed me forward.
She provides us with that motivation every Tuesday. From a medical perspective, talk to us about what you saw with Tony. You must love stories like this.
Well, you know, I've been seeing Tony for several years, and when he himself approached me and said, you know, I'd love to make these changes in my life, I need some direction. To me, that was that's like, you know, someone's calling me to help them. I'm so passionate about that, and having the patient in the driver's seat and being able to give them the tools needed to really incorporate those changes and make actionable steps. I think he was very responsive, and even if there were, you know, little stumbling blocks along the road, the motivation, the drive, the holidays come up, I think overall knowing your path and seeing it clearly, that's where I think he was very much in alignment with trying to achieve the best version of yourself. I think that you had a very clear mindset, so that really helped him go along.
And I think you've got some charts too that you provided with Tony's
Yes,
case.
I think did we show the before and after?
Yeah, we showed
But
the before
now,
after.
if you look, you know, even the blood pressure, when he started our weight loss program, Body by Bijoor, blood pressure in the 130s, over 90s, and then steady weight loss. This is what I want to show is sometimes it's not a 20-pound drop in, you know, 2 or 3 weeks, and that's okay because it bounces back just as easy. But this is more of a sustained weight loss, and measured yesterday, he's down to 170 pounds from 215 pounds with a very mindful approach, systematic, and looking at the big picture, not getting frustrated with small amounts of weight gain or, you know, knowing that your habits are what make you and make who you are, and then health is a consequence, knowing that your chronic disease will improve, you'll be able to get off medication, just doing it in a very calm, systematic approach. He's been successful.
Absolutely.
Dr. Bijoor, she is a wonderful communicator. She listens very well, and she communicates back and forth with, you know, her patients, especially me. And if I don't understand it, you know, she'll repeat it. If I don't understand it, she may doodle. If I don't understand it, she'll pull technology up and show me a picture of, okay, now I get it. And I mean, that's really important, the educate. So she's not only, you know, my family physician, she's a teacher. She's teaching me a new lifestyle. And I bought into it, and it's been very, very successful.
I love to see it, and that's really that's your whole philosophy of what you do. You treat each and every patient as an individual and figure out what works for them. For people who don't know about Oakview Medical yet, you won Best of the Upstate in several areas too. Tell us about that.
Yeah, we won in 2019. We won Best of the Upstate in Best Weight Loss Clinic, Best Wellness and Mental Health Practice, Best Medical Spa, and Best Personal Training Services. And that's been really a very proud achievement for us and my entire team at Oakview, because not only do we focus on getting you well, seeing you for whatever sickness you present with, we are very mindful of taking that patient from sickness to wellness at every moment, reminding them of their preventive health, their screenings, you know, just incorporating that. When a patient comes to us, that's a very big responsibility, and we feel that all of us really work very hard. I'm very blessed to have a great team.
Well, we've certainly enjoyed it too. Last week you brought in your superfood curry quinoa bowl, a real hit. We wanted to put that recipe up, but we'll have it online here in the next hour or so. But for now, Tony, thank you so much for sharing your story. Dr. Bijoor, always a pleasure to have you. To get in contact with Dr. Bijoor, Oakview Medical Associates is located at 11 Five Works Plaza Court in Simpsonville. The number 627-0444. Dr. Nita, we'll look forward to see you again next Tuesday. And Tony, keep up the good work.
Thanks, Margaret.
We'll send it back to you in studio.